We're here at Palm Valley Pediatric Dentistry Virada.
We were extremely comfortable here.
We see kids from the age of newborns actually until 18.
I was nervous, but they made it really comfortable and I love the dinosaur chair.
We're trying to tailor to every single kid. We have iPads, kids can come in and feel homey.
And it's very kids-friendly.
In this room, we mostly do preventative dentistry. We want to provide the best care to our kids. Sometimes moms have a lot of questions, right?
It feels like family here.
Well, it was beginning of 2000 when I was making big decisions. I didn't know what type of doctor I wanted to be. I was in my undergrad studies studying biology. I definitely liked the science part and I was really good at it. But then decision time, what do you want to do next? As a child, I was in an art school. I used to draw and do glue modeling, and that was something I really enjoyed. It never crossed my mind that dentistry can interconnect. I had a friend who was actually planning to go to dental school. And he's like, Olga, you're so good with your hand. Do you want to come over to dental school and just see what we do? And I actually did that. So I came to dental school to observe. They actually had that option in Louisville. I was in Louisville, Kentucky at that time. When I went to dental school, I was observing clinic and one guy was doing a front tooth on a woman who broke her front tooth. And I was fascinated. I was like, oh my gosh, that looks so bad. The tooth is broken to the gum. There's nothing you can do. It looks awful. And all of a sudden, an hour later, the lady came in with beautiful front tooth. I was like, oh my gosh, this is something of my interest. I really like that. So I started to observe more and more, and I realized that my passion for science and my artistic side come together in one specialty, which is dentistry. Thank you. Good job. That's it. When I started dental school, my son was 3 years old. So I had a kid before my whole educational journey. I was a young mom. I was worried about it. I remember my white coat ceremony graduation, and Christian was sitting and eating crackers. They gave me a white coat and he looked at me, he's like, Mom, you're a doctor now. And that was my first day in dental school. And then the journey of dental school went by quick. I didn't know a lot of things. So Chris, my oldest child, ended up having a lot of cavities. I was like, oh my God, my kid is getting cavities. So we actually took him to a pediatric dentist. It was my first encounter of pediatrics. I was like, oh my God, this guy can fix my kid's teeth. And I still remember Dr. Phillips. He was an older gentleman who sedated Christian. Christian did great, and we just came. He got sedated, got all his teeth fixed, and I didn't have to worry about it. That was it. And I was like, oh my God, that's interesting. That's pediatric dentistry. It became like a little puzzle. I like science. And then in pediatrics, we also have a big medical part. I actually need to know all the syndromes, all these diseases. I need to know oral presentation of all these diseases. So I was thinking, that's really cool. So I'm not just a doctor who drills and fills. I actually can understand the prognosis. I can understand the diagnosis. I might suggest to my current patient, Mom, maybe you should get on that vitamin C or check your vitamin D levels and so on. And that triggered my interest. So I started to observe more in dental school pediatric clinic, and I had one of the most talented professors there. She would pretend that she is a different animal. And all of a sudden, me, her, and the child, our patient, all playing one game. We're sitting down, we're doing extraction on the kid. Kid is cool, we're all doing these noises, and at the end, we're done. I was like, oh my God, it has artistic part of it too. Hello, good morning. Hi, I'm Dr. Olga, nice to meet you. Who do we have here today? What's your name, my dear? Christina, how did you do? In the middle, okay, sounds good. Let's take a look at your pictures first. I'm gonna look at her panoramic X-ray. This is a big X-ray. Looks really cool. Look at those teeth. Oh, wow. All right, let's take a look. I'm gonna put my mask on. I'm gonna put my super cool glasses on. I'm gonna look inside your mouth with my special mirror. Can you bite and smile for me? Good girl. All right, we're all done. Good job, Christina. She will need sealants, a protective coating for her back teeth, okay? We took her panoramic X-ray. She's not missing any teeth, no pathology. Everything looks really good. Keep up good work on brushing and flossing. Bye, Christina. I'll see you next time. It was so nice to meet you. After graduating my residency as a pediatric dentist, I joined one of the big corporate groups. Corporate experience was not the best in terms of not be able to do what I want to do. And I knew I can use better material. For example, I really like suctioning device Isolite. And if you're my patients, you know we're using it because it's a great isolation. Fillings last longer. And they couldn't provide this for me. I was not happy in that place. And my dear husband, who has a business head, he's like, Olga, you keep complaining about the same thing over and over again. You don't like this, you want to do this. Why don't you create your own? And that's how Palm Valley Pediatric Dentistry started. That's how our whole journey began. We created a brand, we call it Palm Valley Pediatric Dentistry. I want to be next to my house, and that's when we opened our first location at Goodyear Palm Valley Pediatric Dentistry. We opened a second location in Surprise because we noticed that some patients are driving a distance. And then later on, we opened another location in Buckeye, Virado. I'm in Virado right now. We built this beautiful building. Since we became bigger, then I started to hire dentists. Next one was Scottsdale, and new office now is in Chandler and Mesa. So we're kind of covering the whole entire valley. We opened our first practice in 2013, and the latest practice was opened just this spring in 2025. So we grew a lot, we learned a lot from our experience, and I don't think it's the end. We want to provide that best care to our kids, and our team, we hire only board-certified doctors, orthodontists, and pediatric dentists by developing our brand, developing this interesting way of thinking about providing care to children. We're trying to establish the same type of practice where priority are children, priority is overall health. It's not a drill and field practice. So all this would never happen without my husband. My husband is a big part of our practice. Adrian was my biggest supporter. He always cheered me up for my ups and downs because a private practice and opening your own business is not an easy task. I would probably never have so many vacations if it would be not my husband, because we all have different hats. So I'm the doctor side and clinical side, he is all business side, team side. So it's a perfect combination because my husband has business managing background, also law school background. So it's a really good synergy between me and him that allowed us create this big brand. Understanding the brand, I'm learning from him a lot because I know dentistry, and a lot of dentists, we're just like focused on just one thing. But business side, I'm not familiar with. So he is definitely a big contributor to success. So fun fact about Palm Valley Pediatric Dentistry and Orthodontics. Now we have 6 locations. We have 9 doctors. We have about 50 family members or our big team. We grew a lot. We started from 1 practice, 1 doctor, 1 assistant, 1 office manager, and now look at us. That's a dream come true, actually. American dream come true. Hi guys, we're here at Palm Valley Pediatric Dentistry Virada, and you guys are gonna see how the office looks inside and what we can do. Come on over. All right, we have probably the biggest reception than any other offices. It's just so spacious. Kids love to come here. We have iPads. Kids can come in and feel homey. We actually have kids who don't want to go back and upset because we're taking them away from the game. We have this awesome table. Some kids just play around, and then when they're there, they're like, "Oh, they're done. I want to go back and play." So it's good and bad, but it's very good because kids enjoy coming and they have really, really cool experience. We also have special private room because that small private room is for little kids because you have combination of different ages. We see kids from the age of newborns actually until 18. And this room is for younger kids. We have this cool little toys with basketball, arcade games. So kids come in and they chill and they have fun. Some moms want to teach the kids how to be independent. The kids are playing, and that's because it's glass. They can nicely sit down here and watch the little one playing. That way moms feel comfortable and kids feel independent. This is our front desk team office. This is Sarah. Sarah been with us a couple of years now. She greets you with a beautiful smile. She's always glad to see you and answer all the questions you have. Sometimes moms have a lot of questions, right? And we're trying to help you guys. We're trying to answer all your questions and come up with any possibilities and ideas. We work with you. A lot of moms, they come in defeated. They feel guilty. They feel, oh my God, all my kid has like 10 cavities. Can you help? And then when she shares with me this story, I remember me being a dental school student, feeding my first kid juice all day long, giving him like 8 teeth, stainless steel crown. And I remember myself because that's your first kid. Sometimes you don't know. My practice was created based on no judge experience, best experience for the kids. Our mission as a practice is to create an amazing memory, positive childhood experience, which lasts that child for life. Now we're gonna go to the clinical side of our practice, and you guys gonna follow me because I'm doing exactly what patient experience would be like. Or moms, because moms are part of our practice as well. So we're gonna go here. This is nice and spacious. This is our dental chairs. We do x-rays on kids who can sit in the chair. Because sometimes we have parents who are like, okay, they're gonna sit no matter what. And we don't force anybody. We are trying to accommodate, trying to see the level of temper, the type of development, because some kids are not ready for x-rays. So on average, we take x-rays 3 and up. We never take it earlier than that unless it's an emergency. So there's a lot of new technologies emerging nowadays. So we're trying to keep up with the progress and our latest technology. We have digital technology. They have 3D capabilities and not all practices have that. This is our cool brushing station. If your kid came from lunch and they did not brush their teeth at all, sometimes we look and we gently tell them, go brush your teeth. And we create an education experience. We give you a special disclosing tablet. When they chew up that tablet, a lot of times they can see where they're missing from brushing. And then they brush their teeth right here. And then we can take a look and see if they're missing any spots. Do they do a good job brushing? So brushing station is great because we use it for orthodontic patients and pediatric patients. Not everybody, but we're trying to do as much as we can. This is our big bay for pediatric patients. So if we have big families or we have older kids, teens, remember the ages from newborns all the way to 18. So they would have their cleanings done. They enjoy watching movies and we just take care of their teeth here. Also, orthodontists come in here. So Dr. Aaron would take care of all these kids, do their braces. So now we're gonna enter our special room. We call it dinosaur room. A lot of kids love it because it reminds them of playground. They just hop on a chair, they sit comfortably. In this room, we mostly do preventative dentistry, cleanings, exams, fluoride treatment or sealants. Today is the day off, so we don't have anybody in the practice, but I can show you our sterile. We actually have very spacious sterile, so we're trying to be upkeeping with all the technologies. We have our sterilizer, so dentistry is very safe nowadays, not with us, with everybody. It's very safe. If you guys go here, this is our clinical side. That's where we do treatments. This panel is an X-ray, so if we need to take X-ray in the chair, we can do that. This one is just a universal kind of green means that the operator is ready. Red means don't enter because it's not clean yet. And yellow in the middle, so they clean maybe partially. This system helps our team to know what to do. All right, and this is our big operatory. That's where we do our treatments. We have a TV on the ceiling, very nice and soft chairs. These ones we bought later. They're 8-deck chairs. They're really comfortable chairs. So kids are chilling, watching TV, and we have special place for mom. And we have operators like this all the way here. We have another dinosaur room. Sometimes when mom comes in with 1 or 2 kids and they're little and they need a little bit of privacy, we usually put them in this room. It's nice and spacious, kids feel comfortable. We have small TV here, so sometimes if we have a child with special needs and then they watch a special movie, they may bring their own disc, or we have Netflix in other rooms and they can choose whatever they want on Netflix. And we have, of course, we're a pediatric practice, so of course we have toys. So we have this toothless dinosaur, which is really cute. And if your kid wants to brush his teeth, we can brush his teeth. It's a little educational tool. Sometimes kids feel uncomfortable and they want to hug something, so we have this big toys. We also have weighted toys. So this is all for children to make the experience more pleasant. This is my favorite dinosaur. Hello! Remember, I don't like kids crying. I like everybody having good experience. I don't like stress. That's why everybody loves each other, because we created this brand with no drama brand. Its internal energy is important. And in our practice, we're trying to create such a good environment that our employees like to come, they like to work, and they spread this positive energy into our patients. So this mom, nervous mom, like I was when Christian was little, she feels that she's in the right place. She's home, she can trust. She knows that we will take care of her baby like we would take care of our own kids. So that's how we created this really good positive environment in our practice. All the office, we're trying to create like a big circle. So you're gonna exit here, and when they're done with the appointment, they come here. We have this beautiful art. I love this giraffe, it's so cute. And at the end, they can pick any toys they want. Have really good toys, actually. We invest in these toys because kids love to come. So after you pick a toy, you can pick your toothbrush. We have different sizes. This one is for bigger kids, this is for smaller kids, and they're free to go. That's how we do it here. And again, on friendly reception area, they can make another appointment for come back. At the end of your journey and trip, I want to thank you guys for coming to Palm Valley Pediatric Dentistry and Orthodontics.
Hello everybody. So I've been coming to this dentist for a long time now, and what I really liked was just do it. It's always been a funny joke to me. Even when this machine would turn around, it didn't scare me because I knew it didn't want to hurt me. It just wanted to take a picture of my teeth so they can see what had to fix. Next, they brought me to these chairs. They had dinosaur chairs, but they replaced it to these. I really liked these chairs because it really had most of the equipment that I needed. Now, in this room, there's actually the dinosaur chairs. I was really into dinosaurs, so I really like seeing these chairs when I was a little kid. So, me sitting on these chairs bring me back memories. This dentist was really family friendly, so I really loved sitting on these chairs, even laying down. When they had to take out all my teeth, there was basically a cavity. They had to put a crown on it and they had to replace it with a new one. So I always felt comfortable here.
everyone, Dr. Olga is here. I want to introduce one of our long-term patient mom. Her name is Kara. Can you tell us why did you pick Palm Valley Pediatric Dentistry to begin with? How did you end up with us?
Well, we had tried actually a couple different offices, and each place we went, my kids weren't comfortable, the vibe wasn't right. And then we met Dr. Olga and Palm Valley Pediatric, and we never turned back. We were extremely comfortable here. My kids were comfortable. That was a big thing for me. They took great care of them, and my kids actually liked going, which was huge because before it was, you had to kind of pull them and get them to go. So yeah, we love it here. We love how comfortable we are. Everybody treats my girls with, you know, they can't say enough about it. We love it here.
Can you share with me, why did you like to come to Palm Valley, and do you remember the first time?
The first time I came, I was nervous, but they made it really comfortable, and I love the dinosaur chairs.
Oh,
there.
that's so cool. Yeah, dinosaur chair make a big difference. Are you scared to come to the dentist, or?
No, I'm not really scared because you guys make it really comfortable.
Oh,
and
that's good.
I feel safe here.
Oh, that's wonderful to hear. I can't tell you enough how many times I've seen moms or dads who actually had a very negative experience in childhood and now they have dental phobia. That's what my goal is. I want this kid to grow up and know that dentistry is just okay, it's fun. I just want to brush my teeth. I don't want to have cavities. That's why I'm doing this. And if I do have cavities, it's not a big deal. That's the theory. That's what I want these kids to grow up with. So this is Flor and her little kids. So they've been patients with us for a long time. Can you tell us why do you come to Palm Valley Pediatric Dentistry?
Yes, so first of all, we went to other offices and one of my friends told me about Palm Valley Dentistry. And when we were here for the first time, the kids loved the environment. It's very kids friendly. They love the dinosaurs. They're dinosaurs fans, so it was amazing. He got to go to other places and he was afraid. And when we start coming here, he's just not afraid anymore. Every time I said we have a dentist appointment, they already know what to expect. They love coming here. I know in the future they will not be afraid to continue taking care of their smile because they have such a good experience here. Also, the locations are really convenient. Because of their school location, sometimes I have to schedule in the other practice without a problem. So we love it here.
I want the best for my kids, my patients. I care about them as much as I do care about my own. And I'm the mom of 3 kids. And we had different experience with all my 3 kids. I don't like kids crying. I don't like those negative experiences these kids can get in dental office. And that's why in our practice, we're trying to tailor to every single kid and see what personality they have. Does this kid can sit still for this time or should we sedate him? Our mission as a practice is to create an amazing memory, positive childhood experience, which lasts that child for life. We have my former assistant.
Yes.
So Laura started with us when she was pregnant and she was part of our team. And then all her kids became our patients.
Yes.
So Laura, can you tell us why did you start with Palm Valley in general? Why do you bring your kids here?
Well, we love you.
Thank you.
And just it feels like family here. All my kids love coming here. They feel comfortable and safe. They're never nervous to come into the dentist. They love seeing you.
Do you remember very first time when you guys, I think you guys came for like a second opinion.
Yep, and again, immediately we came and we knew, almost immediately, especially after meeting Dr. Olga, that this was the place that we were gonna end up because they answered all of our questions very thoroughly. They took the fear out of my kids, so it was a no-brainer for us. We knew we were here for the long haul.
I enjoy seeing my little patients to grow. It's just such an amazing experience. I remember them little girls, and all of a sudden I see them every 6 months.
Yep.
All of a sudden they're bigger.
Yeah.
Then we transform from dinosaur chairs to big kids chairs.
Yep.
And now we're teenagers, we have different interests.
Yep.
It's just amazing.
And they still love coming.
Because we provide orthodontics as a dental treatment, we're focusing on making sure the kids have like wider jaws. Nowadays, since epigenetics, so in the population, we actually see less wisdom teeth using the same impact. Their jaws become very small and narrow because of the airway problems. So it's kind of overall for the whole population is changing. So we're catching it early. We're trying to expand the palates. We're trying to create more airway space. So we're trying to set this kid up for success in life. We don't want to ignore certain conditions and then later on he suffers from sleep apnea or something else. So that's the goal, to get your kid healthy, to have a good experience. And that's how we do it here at Palm Valley Pediatric Dentistry and Orthodontics. What do you have in your teeth?
Braces.
Braces! When did you start this?
Yesterday.
Yesterday! Oh my goodness! Did they scan your mouth?
Oh yeah, we
super cool scanner.
Were you able to see your mouse? Was it easier than you thought it was going to be? Yeah, she was a little nervous. What was your
Yes,
favorite
ma'am.
part about your braces?
The colors.
Like picking
The
a color.
colors.
Yeah.
Yeah, that's right. That's right. What about your braces? Where do you do your braces?
I get them done here, and I love them.
How was your experience with braces?
It was really good.
Yeah? Is it easy? You come
It
in?
was easy. You just
Yeah.
come in, and it's really quick experience. And
Awesome. You look beautiful. That
Thank
smile is
you.
changing so much. Would you recommend our practice to your friends?
100%. We tell everybody about Palm Valley Pediatric Dentistry. We have referred many, and every one of them have come back and told me how much they love it and how right we were about them. So we can't say enough about it.
I send all my friends here for braces or just cleanings for all of their kids. Yeah.
Thank you so much.
course.
I appreciate it.
I actually work as a home visitor, and when parents ask me for dentists, I always refer them here.
Oh, that's so good.
Actually, most of my friends come here.
And we're so glad to take care of these kids because we see them from one and we all very sad at the age of 18 when they have to go. It's very kind of touching moment because we see them growing.
Yes, and we're actually expecting right now, so maybe in a year and a half you'll have a new patient.
Can't wait to see your new baby.
I know.
My dream would be to have like integration between pediatrician, pediatric dentist, maybe ENT, and have actually naturopathic aspect to it and have like a very well developed system which would take care of the kid from birth until 18. And we can fix medical problems, we can fix dental problems. That's my dream. So first time we want to see your child on a dental side is at the age of 1 or when first you set up. So we see your young child as young as 1. You guys grow with us all the way until you go to college at 18 or go to work. So it's a whole childhood experience. Technically, we'll be glad to take care of your child in different stages of we understand the development, the growth. That's what pediatric dentists are trained for. And our team are specialists. We're not just a general dentist, we're pediatric and orthodontic specialty. What pediatric dentistry provides. So we provide a lot of preventative care. Majority of our care is actually preventative and it's our goal. So it's a cleaning, scaling, using Cavitron scaling. Also we do sealants. Sealants is like a protective coating for the permanent teeth. And if your child happen to develop cavity, we do fillings, which is a white color composite restoration which preserve integrity of your tooth. And if your child has a bigger cavity, then we do different type of crowns or caps. Some of them are stainless steel, which we still love because it's a less tooth reduction, or white crowns. Some moms don't like that silver, so we do stainless steel crowns. In my practice, we don't use amalgam. Everybody's scared of it because of the mercury content. Since I opened all my practice, I didn't even buy amalgam, we don't have it. So we use only BPA-free, safe to use, good composite restorations and stainless steel, surgical stainless steel crowns. And if your child needs to have an extraction, we remove the tooth and we put a spacer, sometimes do chair side if it's just one unit, or we had a scanner and we can do bigger type of space maintenance. So also we see your kids for emergency. If your kid happened to play, for example, basketball or baseball and broke front tooth, then we will do nice composite restoration or crown which would match with the other teeth. And that's big of our practice. It's kind of a bread and butter of pediatric dentistry. Pediatric dentistry side is simple, the behavior side is difficult. So that's why we provide all kinds of sedations and different type of behavior modificational techniques. If we have a younger kids, for example, if we have 2-year-olds who are sleeping with a bottle and they develop baby bottle decay, for example, or just in general, somehow they develop baby bottle decay, which is Francis advanced decay. If the child is under the age of 2, we actually provide non-invasive dentistry. So what we do, we apply SDF. SDF is a silver-based medication, silver diamide fluoride. So what it does, it kills the bacteria and stops progression of the decay. When your kid is older, but they still have like just naturally very high anxiety, then we can provide oral conscious sedation. When your child is not completely unaware and unconscious, they're just more relaxed. And some of them watch TV and kind of take a light nap. We monitor with hospital level monitors. In that way, we can provide care for that child like I did for my own kid when he was little. Oral conscious sedation is kind of a unique niche, which is dying art, I would say, because in many practices it's just either laughing gas or general anesthesia. There's no middle ground. We provide middle ground, which a lot of parents appreciate. When the child becomes more comfortable, easygoing, then we may use just the laughing gas. And then laughing gas, we kind of phase your kid out at the age of 10. When they reach 10, some kids 12 age, we're saying, you know what? Now it's time to develop your coping skills. At 10, we're doing just local injection and doing treatment without. But local injection, I have a new tool. I love new technology, and now we're using SON. SON is a new type of computerized admission of local anesthesia, which is very gentle and it does not hurt. Now all the moms, if you're part of our practice, they're like, Dr. Olga, what are you doing? What is this? I'm like, it's a thermometer. We don't use needles anymore. It's new injection technique, but it's computerized admission, has very tiny little tip on it, and it's slow, and it numbs really good. It numbs just the tooth, not the whole mouth. So we are introducing those technology every time. And once when we bought this device, it was funny because I was driving with my husband and I was telling him, Adrian, I am in love. I am in love. He's like, what? I'm like, I got this amazing device. I'm such a nerd. I'm like, I got this amazing device, which doesn't hurt when you do injection. It's so cool. And it makes me my job less stressful. Kids love it. Everybody happy. So that's positive environment we're trying to create. That's our brand, Palm Valley Pediatric Dentistry. I always listen to different new advanced technologies. I'm taking different lectures. I'm trying to be open-minded because now dentistry is becoming part of the big picture. It's part of medical assessment of the children and so on. So airways became a big deal now. So now taking a lot of CE classes, now we're helping actually newborns. We're doing assessments with lactation specialists. We do go by recommendation. We work with lactation specialists as the last resort. If that baby cannot improve with transferring milk or sucking, then we would do release of lip and tongue tie. So we actually have lactation consultant in our Dolghier practice, and we screen kids for any type of restrictions in the mouth. So if mom is struggling with nursing, then we will be glad to take care of tongue or lip tie using special CO2 laser. CO2 laser is different from diode laser. CO2 laser evaporates water from the tissue, and that way it cuts, so healing is faster. There is no reported infection. So CO2 laser is the laser you want to have. Our practice is integrated. We have orthodontics and pediatric dentistry. We use panoramic X-ray for our patients. We do it from the age of 6 and we do it every 5 years. And orthodontist, he does use this part of machine which we call cephalometrics. Cephalometrics is when we actually measure the profile of the person, see all the dimension. In orthodontist based his recommendation based on cephalometric mostly and panoramic as well. So this is a really big part of overall diagnosis. We're all digital. It's actually a big part of our practice. And I bought the best sensors. Ours are chic sensors. They are pricier than average sensor, but we get the best image. It's less radiation because it's digital. Sometimes you can misinterpret diagnosis and miss a cavity or see more cavities than you should. So it's kind of very, very important to have a good quality X-rays. The distinct characteristic of our practice is that we are, as I was telling you, trying to keep up with technologies. Now, Invisalign scanners is kind of an emerging field. Now braces, they call it analog, and Invisalign is digital. So analog is old traditional braces, and digital is new technology and clear retainers. So we have this awesome iTero scanner. So now it's not scary. I don't know, moms, if you remember that gooey stuff we had to put in your mouth, you have to sit still for 5 minutes until it's set. Guess what? We don't do it anymore, only for special occasion. But most of the time we use this amazing iTero scanner, and we scan. So kid is just sitting in a chair and we are just like scanning the whole mouth. And now we're able to do it on pediatric side as well. Now Invisalign, surprisingly, we can do it actually on little kids as well. I like it because I see improvement on oral hygiene, because with brackets, braces, it's kind of tricky to brush around every single tooth after you eat. With Invisalign, we see more and more improvement in oral hygiene because they have to brush their teeth before they put the trays in, and it's not as difficult. So we're kind of slowly switching case by case towards Invisalign, and I think it's the future. Remember, digital versus analog. That's how we do it here at Palm Valley Pediatric Dentistry and Orthodontics. As I told you guys, I get a lot of new education, new technology, and we bring this to our team. Twice a year, we have doctors meeting when we share new information. We're trying to improve ourselves. We're trying to learn new technology. We're trying to introduce new devices in our team. And when we hire new assistants, we're trying to have a right person for the team, also making sure that they do have certifications from credentialed assistant school, X-ray certification, criminal polishing certifications, CPR. We do CPR together because CPR doesn't last every 2 years. So every 3 years, we do CPR training for the whole entire team, and that's actually fun when we do CPR training together. For doctors, we always keep up with CE classes, sharing our experiences with HR, keep up with Pulse certification and other certification we need to have. For our front team, we're looking for beautiful smiles. We're actually looking for professionals. We're actually trying to find somebody who knows dentistry, who understands insurance very well, and then we train them. We have an amazing manager. She's like a mama bear. She takes care of everybody, and she plays a huge role in hiring our assistants and future employees. This is our front desk team office. This is Sarah. Sarah been with us a couple of years now. She has back office experience as an assistant, so she knows what are we using, how we're using. She did general anesthesia with us. She did conscious sedation with us, and she has how many years overall? Like 10?
Over 10, almost
over 12 years of experience in dental office. So when Sarah became a team member of our big extended team, we were so excited because she had 12 years behind her. And we are your favorite practice, right? We love our team, and we do a lot of activities with our team because we enjoy to actually be with each other. So we go to different basketball, baseball events. Every month we do a special team building event together where our assistants and our team actually give positive feedbacks to each other, and then we count how many who got. We do it very commonly. It's so much fun, and it's so neat to see how they help each other, and those feedbacks and positive notes actually create really healthy and good environment. Also, we do a lot of events for Christmas. We all get together, so our team sometimes do something on their own. So we have very family-oriented environment, and we love our team. Palm Valley Pediatric Dentistry and Orthodontics trying to provide as much outreach and support to local school teams, local sport teams, local schools for different events. Local community loves us, and we're very grateful that we have this opportunity to help. We support McDowell Little League baseball team and Scottsdale. We are part of Phoenix Suns dental team. We are part of Diamondbacks dental team. So we are trying to be involved in community in many different levels. My kids go to Great Hearts, and we have a great participation in the sponsorship for Great Hearts. We actually provide funds for their scoreboard. So we're doing as much as we can. We go to daycares, trying to educate little kids and try to provide the best approach. We do amazing oral health education in different schools. Those events are very popular between kids because we're trying to make oral health fun. We're trying to teach little kids brushing and flossing, asking them tricky questions. When it's Halloween time, our team is almost at every single school event. Also for Christmas, we provide support to local community and local schools. So if your school wants to see us, we will be glad to come over and help out with those brushing techniques. That's how Palm Valley Pediatric Dentistry and Orthodontics reach out to our community. Our mission as a practice is to create an amazing memory, positive childhood experience which lasts that child for life.